Hello and welcome. Today we'll be discussing a common and often uncomfortable condition affecting the urinary system: bladder clot retention. We'll explore what it is, why it happens, and how it's managed. Bladder clot retention occurs when blood clots form and accumulate within the bladder, preventing the complete emptying of urine. Several factors can contribute to this. The most common cause is bleeding within the urinary tract, often stemming from conditions like benign prostatic hyperplasia or BPH, particularly after procedures like a TURP or transurethral resection of the prostate. Other causes can include bladder cancer, bladder stones, infections of the urinary tract, trauma to the bladder, and even certain medications that increase bleeding risk. Occasionally, surgical procedures in the pelvic area can also trigger bladder clot retention. Let's understand how it works. Blood enters the bladder often due to damage or inflammation of the bladder lining or prostate. This blood then coagulates, forming clots. These clots can then obstruct the bladder outlet, making it difficult or impossible to urinate. The bladder becomes distended as it fills with urine and blood, leading to pain and discomfort. In severe cases, the back pressure can affect the kidneys. The formation of these clots hinders the normal function of the bladder, which is to store and expel urine efficiently. While precise statistics are challenging to obtain, bladder clot retention is relatively common, especially among older men with BPH. Its prevalence increases following urological procedures such as prostate surgery, cystoscopy, or bladder biopsies. Individuals with underlying bleeding disorders or taking anticoagulant medications are also at a higher risk. The symptoms of bladder clot retention can range from mild to severe. The most common symptom is an inability to urinate or a weak urinary stream, despite feeling the urge to go. You might experience lower abdominal pain or distension. Blood in the urine, known as hematuria, is a key sign. You could also feel a persistent urge to urinate, even when the bladder is empty. In severe cases, you may experience nausea, vomiting, or even confusion. Diagnosing bladder clot retention typically involves a thorough medical history and physical examination. A doctor will assess your symptoms and perform a physical exam, including palpating the lower abdomen to check for bladder distension. A urinalysis will confirm the presence of blood in the urine. Ultrasound or a CT scan of the abdomen and pelvis may be performed to visualize the bladder and identify the presence of clots. Cystoscopy, which involves inserting a small camera into the bladder, can directly visualize the clots and identify the source of bleeding. While not strictly classified into types, the severity of bladder clot retention can be categorized. Mild cases may involve small clots and minimal symptoms, while severe cases involve large clots causing complete urinary retention and significant pain. The duration of the clot retention can also vary, with some cases resolving quickly and others requiring prolonged management. The primary goal of treatment is to remove the clots and control the bleeding. Initial management often involves inserting a large bore catheter into the bladder to drain the urine and clots. Bladder irrigation, using sterile saline solution, is then performed to break up and flush out the remaining clots. Continuous bladder irrigation can be necessary to prevent further clot formation. In some cases, medications to control bleeding, such as aminocaproic acid or tranexamic acid, may be administered. If bleeding persists or is severe, surgery or other procedures may be required to stop the bleeding source, such as cystoscopy with cauterization, or in rare instances, embolization of the bleeding vessel. Preventing bladder clot retention focuses on managing the underlying conditions that increase the risk of bleeding. For individuals with BPH, appropriate medical management or surgical intervention can reduce the risk. Careful management of anticoagulation medications is crucial. Staying well hydrated can help prevent concentrated urine and potentially reduce clot formation. Post-operative care after urological procedures should include close monitoring for signs of bleeding. The prognosis for bladder clot retention is generally good with prompt and appropriate treatment. Most patients experience relief of symptoms and restoration of normal bladder function. However, recurrence is possible, especially if the underlying cause is not adequately addressed. Recent research focuses on improving techniques for bladder irrigation, developing more effective medications to control bleeding, and refining surgical approaches to minimize bleeding during urological procedures. Studies are also exploring the role of minimally invasive procedures, such as robotic surgery, in reducing the risk of bladder clot retention.
Thank you for watching!